Hi everyone, this is Dr.RUkmani Choudhary and you're watching Everyday Health. My today's topic is pleural effusion, abnormal amount of fluid that is collected in your lung pleura. So in today's video, I'll be talking everything about like what is pleural effusion, what are the causes behind pleural effusion, sign or symptoms, required test, diagnosis part, treatment in allopathy, best effective homeopathy medicine to treat pleural effusion. So I requested to watch complete video for and subscribe my channel for further notification. So let's start with definition. Pleura is usually the layer that protects your lung. Normally there are some amount of water, that is 1 teaspoon of water are there to protect your lungs, to help in breathing, to ease your breathing, for the lung movement. This is the normal amount of fluid, but due to any reason, certain infection or other medical condition, abnormal amount is collected and that leads to pleural effusion. What are the causes behind this and why this fluid collected over here? There are certain causes like there is a leakage from the surrounding organs, and the commonest one is congestive heart failure. One of the conditions that leads to pleural effusion. This condition, your heart doesn't pump blood towards your body properly, so there is improper pumping of blood. That's how the fluid get leaks, and this leads to pleural effusion. And the other one is cancer. So the cancer of lung tissues, yes, lung cancer, and surrounding tissue cancers like cancer of liver, cancer of kidney even can cause pleural effusion. Infections are there. Certain infection like pneumonia can be there, tuberculosis can be there. These are the infection. There are pulmonary embolism. This is the condition in which the pulmonary blood vessels, there is a blockage in these blood vessels, and yes, there are certain autoimmune disorders, and these are rheumatoid arthritis and lupus. What is the sign or symptoms? What symptoms you have while if you have mild or moderate collection of fluid, then there is no symptom. You don't have symptoms. Symptoms develop while you have severe, when there is a large amount of abnormal fluids are there, when you start developing symptoms. And all the symptoms are related with your breathing problem. Means you have chest pain, there is cough problem, you have shortness of breath, you have pain while breathing, and particularly while deep breathing, and this is called pleurisy or pleuritic pain. So these symptoms can be there, and if there are infection, you can even have fever, shiver, or shivering, chills. These symptoms can be infections. We diagnose this condition. Symptoms are taken, your complete history is taken, and your physical examination, thoroughly physical visual examination is done, and yes, tapping is done. Your doctor may tap on your chest with a stethoscope to check the sound, abnormal sound, to check the fluid. And certain imaging tests are there, and these are X-rays, chest X-rays, MRI, and CT scan. Usually your lungs, they have air, so the image is black. The lungs are filled with air, so there are black shadows. On the other hand, once you have these pleural effusion, and means your lung having abnormal amount of fluid, so you have more part of white shadows. White shadows are there, found in the X-ray and CT scan, USGs. These are the detailed imaging. So these are the detailed study of the imaging test. Thorough synthesis that is done, that is the collection of that fluid to study further that what can be the causes, what is the type of the fluid, whether oxidative or transudative. So to study further about the fluid, thorough synthesis is done. Always depends on the underlying cause, that what cause can be in your case, whether it is due to infection. If it is due to pneumonia, you provided the antibiotics, and if it is due to congestive heart failure, CHD, congestive heart failure, you are given diuretics. So your treatment is completely entirely based on your underlying cause. Now what about the homeopathy? How homeopathy helps you treating in pleural effusion or pleurisy or pleuritic pain? There are couple of medicine, there are different medicine for the different individual. In homeopathy, the first thing is totality of the symptoms, means individualization, means what is peculiar about your case, whether it is on the right side, on the left side, or are you having any other symptoms, or other organ are affected, your kidney, or what other systems are affected, and as a whole, as a constitution, whether you are a lean thin personalities, means you are phosphorus, and whether you are obese like kalika. All these are the medicine in homeopathy that gets changed with the individual even constitution or present symptom or condition, acute or chronic, means you are having all the symptoms are developed suddenly, or you are having all the symptoms from a longer time. so medicine gets changed. And these are not the only medicine. There can be other medicine, different medicine, and you don't have to buy all the medicine. The most important thing, don't buy all the medicine. Just listen, just select according to your case what symptom you have. Accordingly you can select the medicine, you can choose the remedy. And if you're watching on YouTube, you may find all medicines link below in description box, and you can buy accordingly. And medicines form, medicines even color gets changed, so don't get confused, just focus on the main medicine name. So I'm starting with Bryonia. Is the medicine in homeopathy that tops the chart. Bryonia alba, almost specific in pleurisy, pleurotic pain, or pleural effusion. Why? Because once you have these symptoms, you have pain while deep breathing, any kind of movement aggravate your symptom. So Bryonia tops the chart. Bryonia has the keynote symptom that once you move, your problem aggravation, means you have more problem, and there's a stitching pain, more problem on the right side. If you have pneumonia, we prescribe Bryonia alba. This is the oral form, and with the help of dropper, just take 2 or 3 drops 2 or 3 times in a day before having your meal. Phosphorus is given in homeopathy in later stage of pleural effusion, means you are having advanced one, and you are having there's a cough, again shortness of breath, and rust color sputum is seen. Kali carb, again shortness of breath, and Kali carb is given when you have left-sided problem, means your left chest is more affected. So in Arsenicum album. So Arsenicum album is given. Arsenicum album is a over-the-counter in homeopathy once you have cold, cough, or fever, or any infection, any viral flu, any kind of infection. So Arsenicum album is the choice of remedy. Even in pleural effusion, if you are irritable, there is a more irritability, and you have restlessness is there, and midnight vision is there in Arsenicum album. So Argentum nitricum, you have excess amount of cough. Sulfur, in sulfur you have persistent cough, the constant cough you have. So sulfur is the sulf. Hypersulf usually given in you have certain kind of infection, means you can have fever, there is a rigor, there is a chills, and heat alternate. So in these kind of cases, hypersulf is the choice of another medicine, that is ranunculus bulbosus. When you have there are adhesion in your pleura, means your pleural membrane, they are stick together, so there is more problem. And there is another medicine, that is Scilla maritima, that is given when you have pain on the side of your chest. So these are the remedy. There can be other remedy depending on your case. So hopefully this video can give you some amount of help. If you find this video knowledgeable, informative, please like, share, and subscribe my channel for further notification. Thank you for your time. Thank you for watching. Keep watching, keep supporting. Thank you so much.